Welcome to Pursue Wellness. This show is by chiropractors and for chiropractors, helping you with practical science for better patient results, physiology and labs, rehab and exercise, supplements and nutrition, unfounded trends, no opinions, just science. Let's get started.
Hey there, I'm Dr. Callerina Woodard, and today we're going to be talking about blood sugar, specifically insulin and insulin resistance, which rears its ugly head very, very often in our community nowadays. And it's something that's not necessarily tested or talked about enough because it can look like several different things, but it will always lead to health issues later on. So let's start talking about blood sugar, insulin, and insulin resistance. So blood sugar dysfunction can start years before someone gets the diabetes diagnosis, type 2 diabetes diagnosis. We don't typically just go from perfectly normal and healthy to pre-diabetic to diabetic. And all too often we're looking at, on routine lab work, just blood glucose. But not realizing how beautifully we are designed, that compensation can happen from elsewhere, and insulin could slowly be rising and keeping blood glucose normal or within range for years before dysfunction is actually found. So we really need to understand a little bit more about insulin and insulin's job, and then also A1C, and then also be able to look at someone's whole physiology when it comes to how well their body is balancing their blood sugar. Because dysregulated blood sugar is a form of stress, and if we're stressing our physiology, it's going to show up somewhere other than just one lab value. And the lab reference range for insulin is also very broad. It's a very broad reference range. So we need to keep in mind what's functional, what's best and healthy, what's optimal for our patients, and that is somewhere between 2 to 6 units of deciliter for their fasting insulin. So insulin impacts our fertility because it has a huge impact on hormones, inflammatory signals, energy production, your athletic recovery, your mood, your cravings, and of course your long-term health. So one of the biggest problems with today's society is that people are only associating insulin resistance with this person must be diabetic. But we see it a lot that someone can be insulin resistant long before their labs become abnormal or begin to trigger some kind of diagnosis. I see a lot of people, a lot of females with fertility issues, males too, and it can be related to some early insulin resistance, some early blood sugar dysregulation. So this conversation, when it comes to understanding physiology early, really helps support health before disease really sets in. So what most people associate insulin with is, like I mentioned, diabetes. But actually insulin is a storage hormone. It's very important when it comes to growth and hormone signaling for overall health. It regulates nutrients. It also, like I said, impacts fertility and inflammation, impacts our hunger signals, our digestion, our ovarian function, and definitely impacts your brain when it comes to mood regulation and cognition. So why are so many people insulin resistant? And what does that even mean? Why are you resistant to insulin? It really just means that your body stops responding how it's supposed to because it's being bombarded by too much blood glucose or dysfunctional blood sugar throughout the day. So we start to become more resistant to the insulin that's trying to come in and rescue us. Things that drive this are definitely ultra-processed foods, constant snacking, because snacks typically have things in them not pure solid nutrients. You're not snacking on chicken breast. If you are, that's great. But the constant snacking impacts your blood sugar throughout the day. Poor sleep, because that's going to impact your cortisol and also stress. Lower muscle mass is a big one in our society today, and muscle is actually something that's extremely helpful when it comes to impacting insulin sensitivity. We are living a much more sedentary lifestyle. We sit a lot more. We're under eating our amino acids. We're on our phones late at night, interrupting our circadian rhythm. Our kids, which I'm going to talk a little bit more specifically about kids because we're seeing this younger and younger, but our kids are sitting in desks all day. They're not outside in the sun. Things like this will definitely lead to insulin resistance earlier on. More liquid calories, smoothies, milkshakes, all that kind of stuff, high calorie drinks, all your sodas, poor recovery, and then briefly, those endocrine disruptors, which I've had conversations with people about a lot. Those are toxins that we're exposing ourselves to in cosmetics or cleaning products, can also cause insulin resistance. So whenever it comes to the insulin resistance, our pancreas starts to produce more and more insulin to try to keep blood sugar stable, because blood sugar is being impacted by all of these drivers. And then what's happening is your pancreas is creating more and more insulin, but over time, this is keeping blood sugar relatively stable for your lab work, but over time it's going to mean that your body becomes less and less sensitive to that insulin that's being produced by your pancreas. So I mentioned circadian rhythms, I mentioned cortisol, I mentioned stress. I mentioned stress a lot actually, but stress physiology has a huge impact on blood sugar, because when cortisol increases, that causes our liver to release more blood sugar into the system. And then stress increases the demand for insulin. Sleep also worsens insulin sensitivity if we're not sleeping well. And then what will eventually happen is all this inflammation will begin to arise. More and more blood sugar dysfunction will arise, and our body will start to go into a little bit more of a preservation mode. And that's where the insulin resistance comes in. The insulin resistance comes in. All of these extra stressors causing our body to send out more insulin to try to give us more energy, more something in the acute. But whenever this lasts for a chronic amount of time, our body starts to downregulate its receptibility to this insulin. When it comes to fertility, ovaries in women are extremely metabolically sensitive. So high insulin levels can stimulate increased androgen production and contribute to disrupted ovulation patterns. So this is that PCOS, which has actually been renamed recently to include the fact that this is a metabolic dysfunction. And speaking from an athletic perspective, it's not, let's go back to the stress physiology piece of this, it's not that we're having high insulin always because we're eating donuts and pizza all day long. It's because of chronic stress. It's because of poor recovery that's actually impacting our ovaries and how our ovaries will produce an egg, which impacts how we will produce progesterone, which will impact how we balance estrogens. So if we're not balancing estrogens with proper progesterone because we're having poor ovulation, that's going to lead to all kinds of disruption in our cycle. And then insulin also affects sex hormone binding globulin, which changes how hormones circulate in our body. The sex binding globulin goes around and it picks up testosterone and it shuttles it. So if by chronic stress and increased insulin, we are impacting our sex hormone binding globulin, we can have less free testosterone for energy. This is one reason why insulin resistance is so commonly associated with PCOS. And I know a lot of people, whenever they think PCOS, as it was previously named, when people think PCOS, they think of the very stereotypical hair on the face, larger female, holding a lot more adipose tissue. But athletes get this too. Athletes, our sex organs are as equally as metabolically active. So whenever it comes to experiencing all these symptoms and these crashes and these energy things, we need to take into account that maybe we should test our athlete, our, not even athlete, let's just say high performing people, those stressed, those go getters, we should test their blood sugar, their fasting insulin as well, to see if over time stress is leading to this dysfunction of blood sugar or leading to insulin resistance. Here are the labs that I would recommend most when it comes to picking up whether or not this blood sugar dysregulation is coming from stressors, those ultra-processed foods, those poor recovery, poor sleep, throwing off our circadian rhythm, all those things. Fasting insulin, you gotta test fasting insulin. That's a good thing to see. And there are patients that don't follow instructions well. Fasting means fasting. Ideally, at least 10 hours will give us the best picture. And fasting means no coffee in the morning, nothing other than water. But also fasting glucose, hemoglobin A1C, triglycerides, your cholesterol, as well as some liver enzymes can tell us some inflammation as well. And then potentially it'd be nice to see C-peptides. I do like testing sex hormone binding globulin just as we can see what it's causing with hormones if we're suspecting more deeper hormone issues. Leptin is a hormone that's going to leptin will respond if you are stressed. Leptin keeps you thin is how I was taught it. So as leptin starts to fluctuate too much out of range, that can tell us that this person's been chronically exposed to stress, as well as other ApoB if it rises. This is one that's more specific that I have been testing on more and more people recently. If it rises, it can tell us that there's more glycation, plaquing, and impacting cardiovascular health. So back to this point that a normal fasting glucose, say someone in their range, they're like, oh, my fasting glucose was 80 or 90. Oh, no, not 80, 90. That does not rule out that this person could have insulin resistance, because that's just one snapshot. So that's why whenever we look at the labs, we need to look at everything, all included. When it comes to the insulin piece and all those other things that I mentioned, fasting insulin, A1C, these can be signs that people could be compensating for years before glucose starts to take a hit. So first, like I mentioned before, that pancreas starts to overproduce the insulin, and this can keep glucose looking normal for a while. Eventually, glucose will rise. By the time that it is rising past 90 and into the 100s for fasting for fasting glucose, that means that we've already missed something earlier on. And I know you've all heard this before about hemoglobin A1C, how it reflects about 3 months prior. But it's important to understand that also hemoglobin A1C isn't a perfect marker, and so we have to look at multiple things because it can be influenced by someone's red blood cell lifespan. So if they're anemic or they don't have enough iron, their red blood cells are going to have a longer lifespan. Or same with menopause. They're not menstruating each month, so earlier on, their red blood cells, they're just going to be living in the system longer, so that can elevate what hemoglobin A1C may be. However, on the opposite side of that, athletes and pregnant people are actually going to be going through red blood cells faster, so that can slightly lower what their hemoglobin A1C might be. So while hemoglobin A1C is useful and it's telling us how much sugar is tacked onto that red blood cell, we need to keep in mind the person and what they're going through. Also, the range, because on most lab work, once you hit 5.7, they're considering that the pre-diabetic. We need to keep a close eye on this. But honestly, it's closer to 5.3 if we're looking at the functional range. We really want someone to be between 4.8 and 5.2 to functionally have a very healthy hemoglobin A1C. But again, when we look at this paperwork, and we say this person's hemoglobin A1C is 5.2, but she's a high caliber athlete. So she's a professional marathon runner, especially, right? That's really going to impact her red blood cells. She's a professional marathon runner, so that's not what I'm expecting to see. That should be a bit lower than that. Those are all signs. This is how we become detectives and we start to ask more questions. Same with, I have somebody who's just recently gone through menopause. She's 51 years old and now she's 5.4. Well, she hasn't had a period in a couple of years or so, maybe a year or more, and that needs to be taken into context as well. So let me look at some of these other factors that can tell me how she's handling blood sugar before I start getting onto her and telling her you have to regulate your blood sugar throughout the day. So again, all these things need context. A lot of people experience symptoms years before they're diagnosed with a metabolic dysfunction of any kind. Fatigue after meals, that I need caffeine later throughout the day, cravings, brain fog, poor recovery, energy crashes, or especially weight gain around your waist. These are all early warning signs. So while I do love lab work, we also have to look at symptoms. Because even things like anxiety throughout the day, that can be a sign of blood sugar dysregulation. The shakiness, the overreaction to sugar, like you have sugar and you're like, ooh, like it overreacts. Things like this can all be signs and symptoms as well before we even draw blood. There's signs that your body is struggling with some kind of energy regulation. And while we like to look at blood work, we need to look at this as well. After looking at our patients' symptoms, what are they telling us? What are they writing on paper? What are they telling us that they're suffering with? And then maybe what is their lab work showing? How do we start to reverse this issue? One, because I am a chiropractor, number one thing I want to focus on is prevention. So I love to catch it before it becomes an issue. I'd love to catch insulin as we start to see that it's starting to rise before glucose starts to be impacted. So number one is going to be restore the physiology. The easiest thing to do, increase muscle mass. Muscle mass is so metabolically active and so helpful, proven to be helpful when it comes to insulin sensitivity. So having somebody weight lift, having somebody increase muscle mass, we don't care about what the scale says, because obviously we know muscle weighs more than fat, but if someone's putting on muscle, they're going to be more metabolically healthy in the long run. Taking walks after meals to help with blood sugar, making sure someone's getting enough protein intake as well as sleep, managing their stress, managing hydration, just supporting. These are all things that just support blood sugar. Protein intake, like I mentioned, protein intake is incredibly important for making sure someone's not snacking all day, for supporting that growth of muscle mass and recovery, as well as stability of the blood sugar. I'm also a really big fan of fiber. We don't talk about it enough in our diet, but fiber, not just like taking a fiber supplement, eating foods rich in fiber. Even though steel cut oats are a carb, they're still really great at transporting toxins out of the body, but also regulating our blood sugar throughout the day and preventing crashes. And whenever it comes to whole foods, you're going to get more fiber, more hydration, more electrolytes out of things like that. So focusing on those kind of things food-wise rather than the snack culture, that's going to be the best when it comes to preventing insulin resistance. If someone comes into you and they're suffering with fertility issues or all those other symptoms, let's start with these things first, stick to this for a few months, and then retest and see where their insulin falls next. Prioritizing movement and being outdoors is so important for kids. So this is when I'm saying preventing insulin resistance early, before adulthood. The sugary, ultra-processed foods, the soda drinks are the worst for kids. Their bodies are just not used to processing that. And that's going to impact their liver. That's going to impact how their body shuttles those nutrients. It's also something that we know how kids eat. If they're eating those sugary, ultra-processed foods, it's not like they're going to eat that and then go and eat a few eggs or a chicken breast and get their protein in as well. That's going to replace the solid nutrients in their food. So we want to also support sleep. Avoid the constant food rewards for kids. If you do this, you'll get a treat. Or we can get ice cream if you do good every day after school. Things like that will eventually lead to more insulin resistance, when in turn we actually want to focus on long-term health when it comes to these kids. So stable, consistent, whole food focused meals. That's what's going to be the best thing when it comes to kids. Also, being outside, being active, moving. Kids want to move. It's like it's innate in them. They want to be outside, they want to be playing, but those are the things that innately is going to keep them from becoming insulin resistant as they become adults. So insulin resistance is not just about a blood sugar issue. It's a signal that the body is struggling to manage energy in the environment that we're giving it. Physiology always adapts before disease. So we need to look at the symptoms that our physiology is telling us. We need to look at the labs, see what the labs are telling us, and then focus on things like muscle, nutrition, sleep, and recovery, because those are the things that long term are going to keep us more insulin sensitive, keep us stronger, and keep us healthier. We need to take into account what their blood sugar looks like throughout the day. So being educated on some of these things so that you can educate your patients is going to be very helpful. All right, so I hope you have a good rest of the day.